Hey, I'm Dr. Charles Opperman at Simplicity Health Direct Primary Care here in Centerville, Ohio. Want to quickly talk about vitamin D. So historically, we've been using vitamin D, like everyone knows, for bone density to improve bone health or osteoporosis. We got that information from studies that were done primarily in nursing home patients over the years, and it's been historically in the guidelines that we should give vitamin D and calcium to people. However, over the past 3 to 4 years, really 2021, 2022, and 2023, there have been some pivotal trials that were really well done trials studying not nursing home people, but just regular healthy adults walking around. And does vitamin D and calcium supplementation help? It turns out maybe not. So in the most recent trials that were really well done, what are called randomized control trials, where we have a placebo group and we have a group receiving the actual medication or vitamin D in this instance. They've studied high doses, medium doses, and they study patients over 5 years looking at, does this improve fracture risk in healthy adults, not nursing home folks? And it does not. So some of the guidelines might be shifting. Right now, it's still kind of central to use vitamin D for osteoporosis prevention for many of the geriatric guidelines or the endocrine guidelines, but the data is really not there to support it. So we might see some shifts there. We've also seen vitamin D being used for things like depression or vitamin D being used for cancer prevention. When I was in residency or training, we used it for multiple sclerosis. And it turns out that the data really doesn't exist there for that either. It may not be helping. How do you get vitamin D? You get vitamin D through sunlight primarily. That's really the only way we can get vitamin D is through absorption from sunlight from our skin, and then our bodies, our kidneys, transform vitamin D into the active form so that we can absorb calcium. Makes a lot of sense. If we can absorb calcium, we can put it into the bones, get stronger bones, but sometimes our bodies don't work that way, and it looks like that's what the data is showing us. One food that you can eat to increase vitamin D is fatty fish, but other than that, we don't get vitamin D from our diets. So this is a little tidbit on vitamin D. If you're taking vitamin D supplementation, I don't think that it's necessarily dangerous, though if you have risk of kidney stones, that could be potentially harming things. And if you take really, really high doses of vitamin D, you can actually cause some problems with high calcium levels. But generally, vitamin D is considered safe, but whether it's effective still remains to be seen. I'm Dr. Opperman at Simplicity Health Direct Primary Care.